Hello everyone, myself Dr. Soundaraya, Assistant Professor, Department of Pediatric and Preventive Dentistry and Vinayaga Mission, Sankaracharya Dental College and Hospital. Today my topic is about chemomechanical caries removal. Moving on to the introduction, caries continues to affect a significant portion of the world population and the treatment of the decay is associated with pain in many of the patients. So in order to alleviate such painful perception of the pediatric patients, chemomechanical method for caries removal was developed to overcome the shortcomings of conventional caries removal. It is not only more comfortable for the patient but also able to preserve the sound healthy tooth structures of the caries lesion. According to Banerjee et al., chemomechanical caries removal method is an effective alternative for the caries removable because of it brings both the atraumatic characteristics and also the bactericidal or bacteriostatic action against the caries lesion, because it consists of an active ingredient which would soften the pre-degraded collagen of the lesion without pain or undesirable effects on the adjacent healthy tooth structures. Moving on to the history, in 1975, Habib et al. Introduced a method of conventional caries chemomechanical caries removal using a 5% sodium hypochlorite to remove the caries tissues. Since then, many studies have attempted to improve this early technique, and because of the presence of 5% sodium hypochlorite, which is found to be toxic and aggressive to the adjacent healthy tooth structures, therefore a new solution was developed adding a sodium hydroxide, sodium chloride and glycine to this 5% sodium hypochlorite. This modified formula was known as GK101 and it mainly comprised of N-monochloroglycine. This formula was found to be more effective compared to that of a 5% sodium hypochlorite alone, which is more efficient in removal of caries lesion. Moving on to the advantages of chemomechanical caries removal system, it is proven to be an effective and efficient caries removal agent which has method safety, and this system which eliminates the usage of local anesthetic agents and the rotary instruments, and it also lowers the anxiety built in patients, which also reduces the fearful response of pediatric patients. Since it preserves the healthy adjacent tooth structures, it produces conservative preparation, conserves the sound tooth, healthy tooth tissue, and it only softens the infected dentin, and that is only the demineralized dentin containing denatured collagen gets affected and softened and removed. So it preserves the healthy adjacent tooth structures. Because of its gel consistency, it simplifies its application on the tooth structures and reduces the risk of spillage while applying the tooth surface, which is more comfortable for the pediatric patients. And these are some of the chemomechanical caries removal agent. And the first initial conventional product invented was Keridex. It was developed by C.M. Habib et al. From a formula based on N-monochloroglycine and aminobutyric acid, which was named as GK101E. And Krogman and Goldman published first report on this material in 1975, and it gained FDA approval in 1984. It was initially introduced in the US market in 1985. Even though it's based on this effectiveness and efficacy, it was not widely adopted because of its expensive nature and additional clinical time required for its application and the whole working time, and because of its bulky nature, the Keridex delivery system, which was not popular among the dental practice, and also bulky Keridex system which consisted of reservoir, heater, pump and a handpiece with an applicator tip. These drawbacks which led to the less usage of this Keridex chemomechanical delivery system among the pediatric dental practice. And in order to overcome the drawbacks of the previous conventional chemomechanical caries removal system, a new caries removal agents have been introduced during 1980s, which was done at the university by Malmo, heading at Kamers Technical University in Göteborg, was directed towards a more efficient and effective chemomechanical caries removal system than the Keridex. And Dan Eriksson and Rolf Bornstein of Sweden in 1998 of January led to the development of a new patented system for this chemomechanical caries removal agent, Kerisol. And this Kerisol agent is available in various types of syringes like single mix or multi-mix syringes, and its composition, which is based on single syringe, it comprises of sodium hypochlorite 0.5% and syringe 2, that is another syringe which comprises of 3 amino acids. This is the difference between CarieSolve and the Cariedex delivery system. It consists of 3 amino acids like glutamic acid, leucine and lysine, and also other active ingredients like gel substance, adjunct, vehicle and coloring ingredient. Gel substance which is of carboxymethylcellulose, adjunct of sodium chloride and sodium hydroxide, and vehicle is saline solution, and coloring indicator is red. This is the picture which shows the single mix syringes, which comprises of syringes which gets joined and mixed and poured into the separate container, and this is multiple syringe which joins the 2 syringes, and through the mixing of the 2 syringes, and then finally separate the syringes and pour the mixture into a separate container. And another important thing in CarieSolve chemomechanical agent is it for its application it requires specialized hand instruments, which is of it requires 5 special hand instruments for its application and manipulation. The CarieSolve hand instrument 1, which is mainly used for crown margins and areas that are difficult to access, and CarieSolve hand instrument 2, this hand instrument is mainly used for application of the gel onto the caries lesion of the tooth surface, and then it also used for scraping of the softened caries lesion from the tooth surface used with its 4-prong design. And CarieSolve hand instrument 3, which is mostly used to remove caries in smaller cavities like root caries or in case can be used for deciduous teeth, etc. And CarieSolve hand instrument 4, which is mostly used the caries dentin, which is adjacent to the pulpal surface to remove the softened caries dentin from the cavity. And CarieSolve hand instrument 5, which is most commonly used to remove caries at the dentino-enamel junctions. The variations for these hand instruments is based on this cutting designs and cutting ends. The variation and the shape of the cutting ends varies in these hand instruments. And moving on to the CarieSolve difference from other conventional products, like the key difference of CarieSolve from other products in the market is the use of 3 amino acids. That is the main difference of CarieSolve from the other products. It uses 3 amino acids like lysine, leucine and glutamic acid instead of aminobutyric acid. Despite its effectiveness, CarieSolve was not as a blockbuster, mainly because it requires specialized training, specialized hand instruments for its application and removal, and extensive training by the professional is needed. And as said before, it customized instruments which increase the cost of the solution. So because of these drawbacks, few people had access to the CarieSolve chemomechanical agent. And this is the clinical procedure for the application of chemomechanical CarieSolve agent. First, initially we need to mix the 2 components. Since it is available in a syringe technique, either single mix or multi mix, it needs to be mixed initially according to the manufacturer instruction, and the gel should be poured in a suitable container. And after that, the CarieSolve instruments, separate hand instruments used to pick the gel and apply it on the caries dentin of the cavity. Then let it soak the caries for a period of 30 seconds. Wait for at least 30 seconds for the complete chemical process to degrade the collagen and the infected caries lesion. Next, followed by we have to select a suitable hand instruments that matches the size, position and accessibility of the cavity. After selecting, then scrape the superficial softened caries dentin. Then the hand instruments most advised was a multi-star tipped instrument which may facilitate the early penetration of the gel and works carefully using scraping or rotate movements. Then keep the lesions soaked for another 30 seconds if any cloudy surface still present on the cavity. Repeat until no longer turns cloudy and the surface feels hard using the hand instruments. While checking with the hand instruments, the cavity should not be cloudy and the surface need to be felt hard. Check extra carefully for caries at the dentino-enamel junctions. If you are using any drill, if you are using a drill to adjust the periphery before filling, this can be done while the gel is still in the cavity. And when the cavity is completely free from caries, that is infected caries lesion, remove the gel and wipe the cavity with the moistened cotton pellet or rinse it with lukewarm water. Inspect and check it with the sharp probe for hardened surface. And After making sure that the cavity is completely free from caries, next proceed to the next procedure. If the cavity is not free from caries, then apply again the gel and continue scraping for another 30 seconds. And if necessary, the periphery of the cavity should be adjusted using hand instruments or the drill. Next, restore the cavity or the tooth structure with the suitable filling material like GC type 9 GAC according to the manufacturer instructions, and complete the procedure. This is a clinical picture which shows the application of chemomechanical agent. This is the lesion, which is infected lesion, which is present in the 7-5, and after proper rubber isolation, suitable chemomechanical agent like Keresolve is applied into the gel is applied onto the cavity, and after leaving it for 30 seconds, complete. This is the final aspect of the cavity after removal of the caries lesion. Leaving it for 30 seconds, and after this is the final aspect of the cavity after removal of the particular caries lesion. And this picture which shows the final restoration after the removal of all the soft and caries dentin, and final restoration of 7-5 with GC Fuji 9 glass ionomers cement. And next, recently evolved chemomechanical agent is Papakeri. It was introduced in the year 2003. Research project in Brazil led to the development of a new formula to universalize the use of chemomechanical method for caries removal and promote use in public health. This new formula was commercially known as Papakeri or papain gel. The composition it is basically comprised of papain, chloramines, toluidine blue, salts, thickening vehicle, which together are responsible for the bactericidal and bacteriostatic and also anti-inflammatory properties. Papain is derived from a latex of leaves and fruits of green adult papaya, and papain is considered as an effective ingredient because it is indicated in all phases of cicatricial process, and it promotes chemical debridement, granulation and epithelialization, and stimulation of tensile strength of the scars. Dawkins et al. Have stated that Carica papaya, which is derived from an active ingredient of papain gel, has a bactericidal and bacteriostatic properties which inhibits growth of gram-positive and gram-negative organism, which is the most common principal organisms in the oral cavity, especially in the infected caries lesion. So, moving on to the clinical procedure. First is make sure radiograph should be taken. Make sure that infected caries lesion is only limited to the dentinal surface, and after that thorough prophylaxis of the region should be carried out. After rinsing with the water or air spray, and proper isolation should be done on the particular tooth surface. Then application of Papakeri gel should be done on the respected tooth surface, allowing the chemicals to work for 30 to 40 seconds. Here papain gel, which acts by breaking the partially degraded collagen molecules, contributing to the degradation and elimination of the fibrin formed by the caries process. Because of this, oxygen is freed and bubbles appears on the surface, which gives the cloudy appearance and blurring of the gel, thus noted on the cavity. And once a bubbled appearance was seen, then the removal of the soft caries dentin using the spoon excavator need to be carried out. Usually opposite side of the excavator is used for the removal or scraping of the soft and caries dentin, and promoting a pendulum movement is advised. That is, pendulum movement is advised for the scraping of this caries lesion, that is especially the softened tissue from the cavity. It need to be scraped out. Application of gel if necessary. If still soft caries dentin is persist, if additional application of gel can be done if necessary, and after that leave it for another 30 to 40 seconds and scrape out the softened caries dentin. Make sure that it shows the hardened surface before proceeding to the restorative procedures. The vitreous aspect of the cavity appears when the cavity feels free from the caries. So once the vitreous aspect of the cavity appears, that is clear aspect of the clear appearance, that is hardened surface appears on the cavity, then proceed to rinsing of cavity with the chlorhexidine or water spray, and followed by drying with moisture free and oil free air. Then at last finally proceed to the restorative procedure with the suitable filling material according to the manufacturer instructions. Next is the recently evolved chemomechanical agent of Cari gel, which was introduced in the year 2010 with the intention of presenting new agent that costs less than that of the Papakeri and is easily available new chemomechanical caries removal agent which was launched in India. It has a main it also has a main ingredient from papaya extract and other ingredients like endoprotein, chloramines and dye. In addition, it contains a specific percentage of essential clove oil from plant sources which exerts its anti-inflammatory, analgesic, mild anesthetic effect which reduces the pain perception of conventional rotary preparations. Since it is also gel based a chemomechanical agent, it does not require any specialized procedure and it produces ease of application, ease of manipulation onto the caries dentinal surface with reduces the risk of spillage. Moving on to the clinical procedure of carie, as seen before, first initial radiograph to be taken to rule out that no pulpal involvement was there on the tooth surface. Make sure it only involves the enameled dentinal surfaces, followed by prophylaxis of the tooth surface on the particular region and rinsing with air or water spray and cotton pellet or cotton pellet with water. Then proper isolation of the tooth surface should be done and followed by application of carie chemomechanical agent and on the tooth surface, followed by the chemical is allowed to work for 60 seconds. Here removal of softened caries dentin using the opposite side of the excavator and promoting a pendulum movement, and the softened caries lesion must be scraped out of, and if necessary reapplication can be done if any softened caries lesion was found on the cavity, and make sure that vitreous aspect of the cavity appears, which indicates the cavity feels free from caries lesion, and followed by that rinsing with chlorhexidine on water spray and drying with moisture free or oil free air, and finally moving on to the restoration procedure with the suitable ideal filling material according to the manufacturing instruction and finishing the cavity preparation, finishing the cavity. Next, the last material of lost and recently evolved chemomechanical agent was Brix 3000, which was recently introduced in the year of 2016, which had been found in Argentina, and it is also a papain based chemomechanical agent which was obtained from latex leaves, fruits of green papaya. The differential factor of this agent comparative to other chemomechanical agent in the market is the amount of papain used, that is 300 units per mg of with the concentration of 10%, and also it is a bio encapsulation based technology by EBE technology. It is a bio encapsulation based gel which gives ideal pH and for its exerting of proteolysis action on the collagen. Because of its enzymatic activity, it has higher proteolytic effectiveness and also has antibacterial and antifungal property with an increase in antiseptic effect on the tissues. Moving on to the clinical procedure of Brix 3000 gel, as seen before, initial radiograph should be taken to rule out the dentin caries lesion is remitted to the dentinal surface, and followed by prophylaxis of the particular area and followed by rinsing of the area. After proper isolation, application of Brix 3000 a gel need to be done in the cavity, allowing the gel to work for 120 seconds, and after making sure that it shows a cloudy appearance which indicates a softened caries lesion, and with the use of excavator with the pendulum movement, the softened caries lesion is completely scraped out from the cavity. If necessary, reapplication can be done, and make sure the vitreous aspect of the cavity appears, and next is moving on to the rinsing of the cavity with the chlorhexidine or water spray and drying with moisture free or oil free air, and final restoration is done with suitable filling material like JAC according to the manufacturing instruction and finishing the procedure. So finally, moving on to the conclusion, here we have seen various chemomechanical agents and its clinical procedure and techniques. Chemomechanical caries removal techniques are considered as an effective method of caries removal compared to the conventional rotary preparation techniques. Although it takes longer time for removal of caries, but it is highly useful for pediatric patients, especially the patients having a fearful and anxiety built while entering the clinic and also during the conventional rotary procedures, which also reduces the perception of pain comparative to other conventional techniques. This chemomechanical agent is found to be an effective one for pediatric patients. So it can bring a promising results in the field of pediatric dentistry for the pediatric patients as well as the special healthcare needs patients. And chemomechanical caries removal agents with added important advantages like it produces a cavity in a non-traumatic or minimally invasive way, and also preserves the healthy tooth structure or adjacent tooth structures without removal of non-infected dentin like rotary procedures. These agents hold an excellent promising field in the future dental practice. Thank you for watching my class.